Hello, my name is Dr. Mahzoon here at United Dental in Redwood City. So we're getting a lot of questions about dental fillings, and I wanted to have a short discussion to answer any questions that you may have. A dentist would recommend dental fillings when there is a cavity in that tooth. So that cavity needs to be taken out and a filling placed in order to restore that tooth. The alternatives to getting a tooth filling are pretty much, you can get an onlay or an inlay, which is porcelain. Depending on the size of that cavity, the dentist determines what type of material to use in order to restore that tooth for you. The pros and cons of different filling materials are pretty much the type of filling that's used. The silver fillings, which I don't use in my practice, controversy with those, with the mercury and the silver, the metal sitting in the mouth. We use composite or the white fillings in our practice. Those are the tooth colored fillings, or any porcelain inlay that we would use. So all of the restorations are tooth colored that I use here in our practice. The procedure for getting a tooth filling is a fairly easy procedure. You will get some numbing. The dentist then removes the cavity and then places a filling. Again, the tooth colored fillings is what we use here. And those are bonded into the tooth. A series of steps is taken to ensure a very good outcome. The tooth colored fillings look very natural. They're the same color we pick as your teeth. And honestly, no one can tell that there's a filling in your mouth. They look beautiful. Cavity fillings that are in between your teeth are done in a similar way to any other cavity filling that's done, except we do have to place a matrix on that tooth in order to get a nice contour, to make it look and be restored as a natural tooth, so that the patient can also floss that area really easily. But it's a similar procedure. A tooth colored filling is placed in between the teeth by using a series of steps to, again, ensure a very good outcome. A dental filling procedure is not painful because the patient is numb. There's no feeling in the tooth while the dentist is drilling the cavity out. And it's a very routine and easy procedure that's done in the dental practice. A patient can request dental sedation while getting a filling. If a patient has really bad dental phobia, then I do prescribe some sedatives. Usually most patients, we have had no issues with this at all. We make sure that the patient is very comfortable. All their questions are all answered and they're confident when they're going through the procedure. So the anxiety level really goes down beforehand. Fillings do permanently fix cavities because during the procedure, the cavity is taken out by the dentist and the filling is placed. So yeah, that tooth is fully restored at that point. Fillings can have side effects. Sometimes if the cavity is quite large and closer to the nerve, then there could be some sensitivity, but that usually lasts only a few days. And we just recommend over-the-counter ibuprofen for that kind of issue, and patients have no issues after that. Dental fillings do match the patient's tooth color. We make sure that all the tooth color fillings, we have a different array of all the colors, and we make sure that they do match the patient's natural tooth color. The aftercare advice one should get after getting dental filling is pretty much if they have pain, to take some anti-inflammatory meds over the counter. Maybe don't eat on that side for the next day until like the anesthetic wears off. Really, the biggest issue is just not biting your lip or your cheek because you're numb. We ask that the patient doesn't eat for a few hours after they leave our practice. Other than that, everything is usually very smooth and no issues. A patient should schedule a dental appointment if they think they need a dental filling by coming in pretty much every 6 months. We can take your routine x-rays and exam, and we will check everything and tell you if there's any findings of cavities and go over all the options regarding the fillings. Okay, so that wraps up our discussion on dental fillings. I hope I've answered all of your questions. If there's any further questions or you want to come in for a consultation and exam, please give us a call at 650-367-4300. Thank you.